Hello, a pleasant day again. Once again, fellow learners, I'm your fact check buddy, Ray Gapuz, your mentor Ray, now giving you some updates on one of the most difficult topics that a lot of test takers are having problems on when they meet this specific concept when they're taking their test. So before we get to start, allow me first and foremost to ask you to join me in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. To help us achieve this, just watch and finish the ads in our videos. That's all I'm asking of you guys. Please, please, please don't skip the ads. And don't forget to share our videos. If you like our videos and if you think your friends can benefit from our video, then share this video. Feel free to do so, please. Okay, if you have anything in mind that you may want me to cover in my future videos, send me your questions or requests through this email, mentor.raygapuz@gmail.com. So this is what I'm trying to tell you guys. It's about computation. Now, this is one little secret that I'm having, and I'd like to share it with you. I really took up nursing because I hate math. Okay, and lo and behold, when I took up nursing several years back, maybe a quarter of a century ago, okay, that's how old I am now. Okay, well, in our curriculum, we only have one math subject, and that is college algebra. And I really tried my best to at least ace that single math subject that I have in our curriculum. So today we're going to talk about how to compute for dosage and solution problems that deals with dopamine and dobutamine. And let's do it in a simple and easy way. That's one thing I'm promising you guys. We're going to do it in the simplest way and the easiest way so that you'll be able to at least give a question related to the computation of dopamine and dobutamine a fighting chance. Whenever you are faced with a question that relates to computation, don't give up easily. Give it a fighting chance. But you know, like any nurse would actually have react to a specific question when we have that question in front of us in the computer, the moment we get to see the numbers, sometimes some people are short of just having seizures. Okay. Okay. The best way to learn about dopamine and dobutamine computation is actually to have a sample question. So let's try answering a sample question on dopamine. Now, what if, and knock on wood, the first question that pops out on your computer screen when you're taking the NCLEX is this question. The physician orders dopamine at 5 microgram per kilogram per minute incorporated in a 0.9 normal saline solution. The concentration is shown on the exhibit. The client weighs 63 kilograms. How much medication is administered in ml per hour? Enter your answer and you have a blank. And the moment that you've realized that this is not a multiple choice question, that's the moment that you're not just going to say your little prayer, but some people would go into trance, close their eyes, and hope that in their dreams, Jesus will give them a miracle by giving them the number that they should put in that blank. Of course, that's not the way how we should be coping with this question. Now, what is difficult with this question is the fact that, number one, it's about computation. Number two, we have to know which among the numbers that were given in the STEM and that are presented in the exhibit would be significant for us to compute for the correct answer. And number three, you have to know how to read the exhibit, okay? Because you have a lot of numbers here that are presented. So which among these will I use? That's when we begin scratching our head and we would want to, you know, just push eject. We have that mechanism when we're taking the NCLEX, okay? But we don't have the button for the eject mode. So what do we need to do? Let's just deal with it. Here's how. Follow these simple steps. The first one is to recall the constant values for dopamine and dobutamine. So we pay particular attention to whether we are being given a single concentration or a double concentration. For dopamine, Okay, if you're given a single concentration, which means you have 200 microgram over 250 ml or 400 microgram incorporated in 500 ml, so your constant value would be 13.3. Whereas if you're given a double concentration solution, 400 over 250 or 800 over 500, then your constant value is 26.6. For the butamine, if the concentration is 250 over 250 or 500 over 500, that's a single concentration solution, the constant value is 16.6. Now, for double concentration solution for the butamine, 500 over 250 or 1000 over 500, the constant value would be 33.3. So you won't get confused and you don't memorize a lot of numbers. All you have to do is to memorize the single concentration constant for dopamine, that is 13.3, and multiply that by 2 for double concentration solutions. For the butamine, just memorize 16.6 and multiply that by 2 for double concentration solutions. But here's the hitch. You have to be able to identify and decipher based on the label that is presented in the exhibit that would show you whether you are having a single concentration or a double concentration. So this is where it all begins. Don't panic. What is important is you are able to identify your constant values, and that's your first weapon. Let's move on. Step number 2 would be to use the formula dosage times weight in kilograms. That's one thing I'd like you to realize, guys. It should be in kilograms. So if it's in pounds, then you will need to convert it and then divide by the constant. Now, what I'd like to highlight to everyone is the fact that there could be other concentrations of dopamine and the butamine. So we're not saying that these are the only concentrations available. Well, there are other concentrations, but I'd like you to focus on these concentrations because they are the most commonly asked concentrations. Okay? That's one thing I hope you would believe me when I tell you. Talk about experience. Okay, so that's step number 2, using the formula dosage times weight in kilograms divided by constant. And then step number 3 would be to identify the appropriate values. And we do this by substituting the values in the formula, making sure that the values are in the appropriate units, specifically the weight. It should be in kilograms. Okay, let's get down to work. So the question is asking us, the physician orders dopamine at 5 microgram per kilogram per minute incorporated in 0.9 saline, normal saline solution. The concentration is shown on the exhibit. So we would see that this is 400 milligrams over 250 ml. Okay, the client weighs 63 kilograms. How much medication is administered in ml per hour? So we make use of the formula dosage times weight in kilograms, okay, divided by constant. So the dosage, we have it here, 5 microgram per kilogram per minute. The weight, okay, in kilograms, we already have it here. We don't have to convert. And all we have to do is to recall the constant. And the constant would be 26.6 because 400 milligrams over 250 ml is considered as a double concentration of your medication. Okay, so pay particular attention. 400 over 250 is a double concentration, so we make use of the constant, okay, 26.6. Okay, so as we substitute the dosage with 5 microgram per kilogram per minute, and then the weight with 63, and then the constant with 26.6, okay, and then we compute, and we get 11.8. The next concern would be, is 11.8 within the therapeutic range of dopamine? That's one thing you have to be familiar with, because if you're getting more than the therapeutic level of dopamine that is infused in a patient, it doesn't make sense. So it's very important that you have to remember that dopamine has the following dose-related effects. At 1 to 2 microgram per kilogram per minute, your dopamine will dilate renal blood vessels, but it will not have an effect on the pulse rate in the blood pressure. In essence, okay, it supports renal perfusion. However, the dilatation in the renal blood vessels could also potentially, eventually decrease the blood pressure in the low dose level of dopamine. Now, when the dose is increased to 2 to 10 microgram per kilogram per minute, you will have increased cardiac output without increasing the heart rate. In this case, when you have increased cardiac output, that's when your BP begins to increase. And at the level 10 to 20 microgram per kilogram per minute, there will be peripheral vasoconstriction and increased blood pressure. So in which case, it will now improve circulation. And at a level 20 to 40 microgram per kilogram per minute, there's going to be a reverse dilatation of renal and mesenteric blood vessels. When we say mesenteric blood vessels, these are the blood vessels in your abdomen. Talk about the abdominal arteries. In essence, this could potentially lead to decreased blood flow. So now let's try using the same formula on this time dobutamine, and let's get to see how different it is. So here the question is asking you about the physician ordering dobutamine at 2 microgram per kilogram per minute incorporated in 0.9 normal saline solution at 250 milligrams per 250 ml. That's a concentration. The client weighs 198 pounds. That's where the problem is, because the weight is not in kilograms. So how much medication is administered in ml per hour? We need to enter our answer. One thing good about this question is that we don't have an exhibit. So what the data that you need are already in the stem of the question. Whatever you need is already in here. Okay, so we move on the same steps. So step number 1, we call the constant values for dopamine and dobutamine. This time we're talking about dobutamine. So it's 16.6 for single concentration and 33.3 for double concentration. And then we make use of the same formula, dosage times weight in kilograms divided by constant. And then we identify the appropriate values, substitute the values in the formula, making sure that the values are in the appropriate units. Okay, so let's go back to the problem and let's make use of the formula. So the dosage would be 2 microgram per kilogram per minute. The weight has to be in kilograms and we have it in pounds. So we have to convert that and then divide it with a constant. So the dosage, we have it written in the stem of the question. The weight, 198 pounds, we divide by 2.2 pound per kilogram, and that will give us 90 kilograms. Okay, so we make use of the 90 as the value for the weight. And then, of course, the constant will be 16.6 because you have 250 over 250. That's going to be a single concentration solution. Okay, so remember 250 over 250, single concentration. So you make use of 16.6 as our constant. So here we go, and let's substitute. So for the dose, we have 2 microgram per kilogram per minute, and then the weight, 90 kilograms divided by, okay, the constant, which is 16.6. Okay, and that, if we compute, that would yield 10.8. But once again, the question is, don't end there. Is this within the therapeutic range in terms of the dosage of dobutamine? Okay, and we enter our answer here. Yes, because the therapeutic range of dobutamine would be 2.5 to 15 microgram per kilogram per minute, and it should not exceed 40 microgram per kilogram per minute. So if you're getting more than 40 microgram per kilogram per minute, chances are you're not applying the right solution to the question. So remember the effect of dobutamine, it increases your cardiac output. Now, after we've gone through the computation, it's very important now that we identify functional concepts, my favorite, okay, for dobutamine and dopamine. Let's begin. Dopamine is indicated in cardiogenic, septic, and neurogenic shock. Low-dose dopamine may cause vasodilatation and hypotension early on in the treatment. This is the reason why sometimes dopamine is not indicated for hypovolemic shock. It's indicated for cardiogenic, septic, and neurogenic shock. Dopamine may be inactivated by higher pH, so do not add to sodium bicarbonate because an alkaline environment could potentially inactivate dopamine. Dobutamine, on the other hand, increases cardiac output and improves blood flow. So dobutamine is used in septic or cardiogenic shock Plus, it's also used in clients with congestive heart failure. Dobutamine increases the blood pressure, and it is contraindicated in myocardial infarction because of its tendency to worsen the condition, unstable angina, hypertension because of its tendency to increase the blood pressure, arrhythmia because it may worsen the arrhythmia, and of course hypokalemia because in hypokalemic patients, they become more at risk to developing arrhythmia. Remember, dobutamine may increase the risk for rapid ventricular response in clients with atrial fibrillation. So in essence, dobutamine may worsen atrial fibrillation. So it's one of those drugs that are contraindicated in clients with atrial fibrillation. Okay. Also, other drugs that may be contraindicated in clients with atrial fibrillation would be your milrinone, your atropine, and your adenosine. And of course, last but not the least, dobutamine. Remember the code MAD, milrinone, atropine, and adenosine, and dobutamine. Those drugs are contraindicated in patients with atrial fibrillation. So let's summarize. Dopamine and dobutamine are used to treat hypotension, low cardiac output, and decreased organ perfusion. It will also increase pulse rate, blood pressure, and will cause headache, nausea, and vomiting. So these are the similarities in terms of the effects and the potential side effects of both dopamine and dobutamine. So if you are given an item which goes to say which of the following could be the effect that could be produced by both dopamine and dobutamine, then you could actually say it will increase the pulse rate, the blood pressure, will cause headache, nausea, and vomiting. Okay, so your dopamine and dobutamine can be used to treat which of the following conditions. So you can answer hypertension, low cardiac output, and decreased organ perfusion. Okay, now what about the side effects that may occur in dopamine but not in dobutamine? Remember this, class. Dopamine can cause, the code is Gcash, okay, like Gcash, okay? Goosebumps or erection, irregular heartbeat, chills, anxiety, and shortness of breath. So these side effects occur in dopamine but may not necessarily occur in dobutamine. On the other hand, the side effects that may occur in dobutamine is contained in the code PLANS. That's our mnemonic, which means palpitations, low platelets, abnormal heartbeats. Now, this could actually be related to premature ventricular contractions or ectopic ventricular beats, okay? Nervousness, then swelling at the injection site. Remember the code PLANS. These are the side effects that occur in dobutamine, but may not necessarily occur in a patient taking dopamine. So, if you love this short but useful video, please don't forget to subscribe, share, and hit the bell, the like and the bell button so that you'll get notified when I upload videos on a regular basis weekly. And if you share it to at least 10 of your friends, you will pass the NCLEX with a minimum number of items of 75 and a minimum amount of time and effort. Okay, so let's learn together. If you have any requests that you may want me to cover in my future videos, send in your request to my email, mentor.raygapuz@gmail.com. Here's your mentor, your fact check buddy, once again telling you a functional concept a day keeps your NCLEX RN fears away.